clogged TV.
Beyond the policy.
Yeah, welcome back to the KOKO Digest Morning Show. If you're just tuning in, this is the KOKO Digest Morning Show, and we're about to have our main discussion. And I would like to remind you that the month of September is Prostate Cancer Awareness Month, PCOS Awareness Month, and Suicide Awareness Month. So today we're going to be discussing PCOS, which is Polycystic Ovarian Syndrome, with our very own Dr. Victoria Party Newman. She's the resident health physician at the College of Physicians and Scientists here in Accra. So let's get into it. Good morning. How are you doing? You look pretty too. Thank you. So at this point, you are basically our favorite doctor now. So we are glad to have you here again, our favorite doctor. And as this month is PCOS Awareness Month, we would like to just talk a little bit about it, and then we educate our audience or our viewers about it. So what is PCOS, or what is Polycystic Ovarian Syndrome?
Okay, so like you said, Polycystic Ovarian Syndrome, number one, it's a hormonal condition.
Okay.
And number two is chronic. When we say chronic, it means it cannot be cured. It's something that you would live with. It's a hormonal chronic condition in women alone, in their reproductive age. So right from the puberty till menopause, you would exhibit symptoms of PCOS. So usually it's associated with certain symptoms. Yes. And PCOS really, it starts from the brain. So in the brain, we have the hypothalamus, we have the pituitary gland. The pituitary gland is responsible for producing prolactin. Yeah. So there's this condition between the pituitary and the hypothalamus called the hypothalamic pituitary gonadal axis. So when there's a shift in that, it causes an increase in the hormone called the gonadotrophin hormone. And that causes an increase in the luteinizing hormone, which is responsible for ovulation. So if you notice the PCOS, they are saying polycystic ovarian, meaning that the condition is related to the ovary of the woman. Yes. So usually the ovary is 2 to 5 times bigger than the usual size. So 2 to 5 times bigger than the usual size, and usually it's more or less on ultrasound. You see it as a string-like pearl line, which shows that those string-like of pearls are usually follicles that have not released the eggs. So it's like the ovulation, anovulatory phase. So the ovulation is not occurring. The eggs are not being released, and you could have a whole line of it, more than, let's say, 10 in the cortex of the ovary.
So basically, the ovary has produced eggs, but they haven't come out.
Yes.
So is there a way to force them out, or if even the sperm gets there, can those follicles be fertilized? Okay,
good. That's a good question. So usually every woman is supposed to ovulate. And usually with the cycle, we have 14 days after menstruation. That's the luteal phase. And you release the ovary. You release an egg. And the egg travels through the fallopian tube. And then sometimes the sperm, it meets the sperm in the fallopian tube. That can cause ectopic pregnancy. Ideally, it's supposed to meet the sperm in the ovary, in the endometrium, the womb. So every woman has to ovulate. But with the PCOS, because there's a problem with the hypothalamic pituitary gonadal axis, increase in GH and increase in the LH, there's over-secretion of androgens. Androgen is a male hormone. So in the over-secretion of the androgen causes overexcitement of the ovary. So you end up ovulating more, but then you are not releasing the egg. And it's just it just ends in the follicular phase.
Okay.
And then at the end of the day, there's no fertilization.
Okay.
So the sperm will be there, but there'll be no egg to meet the sperm. But the egg is still confined in the ovary.
Okay. So you mentioned male hormones. So does that mean that women have male hormones too?
Yes. So ideally, women, the ovary produces the androgens.
Okay.
It also produces progesterones and estrogens. These are the hormones.
Yeah.
So they produce it in certain constituents, or let's say percentages.
Okay.
Over secretion of the LH hormone, the luteinizing hormone responsible for ovulation, also causes an increase in the production of the androgen, which causes overproduction of the X, or we call the oocytes.
Okay. So do men also have, female hormones too? They don't have any.
They don't have.
So how come
when a man has a female, the reason why the women, we have the bit of the androgen is for the egg production.
Okay.
That's why when it's too much, there's overstimulation of it.
Okay.
For the men, the androgens is also for the sperm production.
Okay.
Yes. But men too can have hormonal balance.
Okay.
That's when we have issues like gynecomastia.
Okay. What does that mean?
That's more or less like mastia is breast.
Okay.
And gyne is women. So breast of so you will see that most of them have big breasts than usual.
Okay.
So they would have to go to the hospital and examine their breast. And then most of the time it's hormonal, or it could be a chronic condition. It could be chronic liver disease.
Okay.
That can cause gynecomastia.
Okay.
It could be medications. Some medication like spironolactone can cause gynecomastia.
Okay.
So those ones are when the estrogens are more in the man.
Okay.
So now we are looking at androgens more in a woman. That's the PCOS.
Okay. So what are some of the symptoms of PCOS then?
PCOS, it has a whole range of symptoms.
Okay.
Psychological symptoms, metabolic symptoms, and then physical symptoms.
Okay.
So we can take it up.
Okay,
So
sure.
we start from, usually there will be the main thing, menarche. Ideally, you are supposed to menstruate 12 times in a year. That's every month.
Yeah.
But then to be diagnosed with PCOS, you menstruate less than 9 times, or you have less than 9 cycles in a year. And usually the interval of the cycle is supposed to be 28 days, at most 30 or 32 days.
Yeah.
But with the PCOS, they have more about 35 days apart.
Okay.
For the next cycle, some even 3 months.
Okay.
Yeah. So basically, we look at irregular menstrual period, like I was talking about the prolonged period, and then also doing ultrasound. One of the diagnoses of PCOS is ultrasound.
Okay.
You would notice a string-like pearl.
Yeah.
You see it that the follicles that's the fluid-filled sacs or cysts.
Okay.
They are cysts around the ovary like pearls. You know how the pearl looks like, and those one is a diagnostic. It's enough to confirm that you have PCOS, but then you would have to also have not been having irregular menses, or you even menstruate and it's very scanty.
Yeah.
We call it oligomenorrhea.
Hey.
Or
Nice.
you would bleed for long periods.
Okay.
More like 3 weeks, 2 weeks. Then we have to look into it.
Okay.
Sometimes too, there's overcramping. People, it's good to have menstrual cramp, but when a child or a young lady or a woman is in starting menarche and there's excessive pain to the extent they have to be admitted, we have to screen for PCOS because those are the excessive cramping. And then bloating of the tummy. You'd realize that once in a while you feel bloated. You should also screen for PCOS. And then also you would have hirsutism. That's unwanted hair, sometimes in the chest, the back, the butts, and then the chin. Yeah, which is not supposed to be in women. When you notice those signs in you, you should screen for PCOS. And also one thing you would know is be observant with your body, because sometimes you are not, usually you didn't start out having hair. Then maybe in your mid-20s, you notice those changes. There's bulge in your abdomen, you gain weight in your abdomen more, now you notice hair, and then there's thinning of your own hair. And then you'd realize that you have hair loss. Some even have male pattern baldness. And those are all symptoms of PCOS. And then there's the one that affects the confidence the most is the skin.
Okay.
Then we have acne, because you could have the best skin, how do you call it, treatment, and still be having the acne because it's hormonal.
Okay.
There's nothing much you can do. And then, so one of the things that, some people say, whenever I'm stressed out, I break out.
Yeah.
We should screen for PCOS,
Okay.
yes. And then also psoriasis of the skin. Some people have a certain skin condition, like eczema,
Okay.
which it's on and off, which is chronic. Those are all, so skin, PCOS really affects the skin. And women, our beauty is the skin. So when it's affected, it kind of affects the confidence.
Yeah, okay.
So most women who have acne, you realize they are not too confident, not because they don't want to be confident, but who would want to walk around with a face with a lot of pimples and then, it really affects that. So they need a lot of support.
Okay.
So this topic is very important for mothers, especially who have daughters who are in the puberty. When they are growing and they have acne and all that, you have to support them. I actually had one patient whose mom, who was in Wesley Girls, and then the mom, she had so bad, like the acne was that very bad, and she was not performing well in school because of that. So they had to involve the dermatologist and all that, and then we noticed that like her confidence was bad because her face was clear. So the skin is very important for a woman, and so that's one. So when you notice those things. And then also, like I talked about, psychological stress, depression, and then you always feel tired.
Okay.
Anything you do, you feel tired, you feel stressed out, like you feel burnt out, you are worn out. It's a sign, and it's very funny. Most hormonal issues or hormonal diseases, it comes out like being burnt out. Like for example, thyroid disease, it's a differential of PCOS because there's weight gain, you feel tired, you feel hypothyroidism. That's low hormone, low level of thyroid. That's have symptoms like PCOS.
Okay.
So fatigue, and then also consistent pelvic pain.
Okay.
Because there's over proliferation of the oocytes, or let's say eggs, in the ovary, and it doesn't sit so well in the body, and then you consistently feel body pains all over, especially in your pelvic area. You should have it checked. And then some people just gain weight easily and lose weight easily. If you are the type, you notice that you easily gain weight. Within a week, you could gain like approximately 2 to 5 kilos. You need to screen for PCOS. And then some people jokingly say, me, if I put my mind to losing, I can just easily lose the weight. So then you could say that there's something that's triggering that. Those things are high cortisol levels. And the PCOS causes the high cortisol levels, and then this cortisol level is the one that causes the weight gain.
So what is cortisol then?
Cortisol is a hormone. They call it stress hormone. So usually we need it in the body, but not too much. Too much of cortisol can cause problems like diabetes, or we have something we call metabolic syndrome. So with that, there'll be diabetes, there'll be hypertension, there'll be high level of cholesterol, that's hyperlipidemia or dyslipidemia. All these three characteristics can cause the metabolic syndrome, and that is as a result of the cortisol being high in the body. So stress is a factor for high cortisol levels, you understand? And if you know you have a family history of PCOS, and you know that you have that kind of stress for life, you should watch out. So some people be like, some girls they like soft life. It's not like they like soft life, but it's like when pressure is thrown at them, they don't do too well with it, even health-wise. So they break down, they have the acne, they break out, they are missing their periods. Then the mood swing comes in. Now they realize their period is also not coming. When a woman's period doesn't come, she's worried.
So it's just a cycle of stress.
Yes, exactly.
Okay. So it is getting very interesting here, and I want to remind you that we are streaming live on Facebook and on YouTube. So send in your questions, your comments, your suggestions to our Facebook or YouTube live stream, or you can even send them to our WhatsApp numbers displayed on your screen. So Doc, is PCOS related to fibroid in any way?
Okay. So I think that's a very good question, because women think every woman's illness or every woman's issue is fibroid. So you notice in the markets and places around, they advertise for products in the name of fibroid. So if a woman has this, it's fibroid. But I beg to differ to know that PCOS and uterine fibroid are two different things altogether, both involving the female reproductive system. But the PCOS has to do with the ovary. And it's affecting the body with overproduction of androgen and then affecting the development of the egg. That's PCOS. When we come to uterine fibroid, it has to do with overgrowth, or should I say myoma, like more or less like a tumor, which is not malignant, which is not cancerous. So it's more or less like a benign tumor of the uterus. And the uterine fibroid, we have different positions. So we have some in the womb. We call it intramural, that's in the muzzle of the uterus. And then we have subserosal, that's outside the uterus, pedunculated, hanging on a thread. So with that one, it's big, it's fibroid, but then it's mobile because it's hanging on a thread from your uterus. With that, you can give birth because it's not in the womb, but it's outside.
So I think we even have
if you
another image.
So if you look at the image, you'd notice the normal ovary on the left side from where I'm sitting. That's the normal ovary, how it's supposed to look like. With a polycystic ovary, it's 2 to 5 times bigger than a normal ovary. And you notice that there's this round globular structures within the periphery of the ovary, which is usually we term it the string-like pearl, which shows that it's diagnostic of PCOS. Yes. With the uterine fibroid, you would notice the structure in the middle, the globular structure in the middle with the cervix. So the fibroid is a growth in that. So we have the fibroid inside, that's the intramural, we have the subserosal. There are different types of fibroid that can grow at different places. Yes. So those
that is not related.
That is not related
to
PCOS. That's for another day.
So, Doc, how or what are the causes of PCOS? Are there things we do that make us susceptible to PCOS?
So, like I said, PCOS is no fault of any woman to have PCOS. So you need to do a good background check on family history. So if you notice your mom, an auntie, or a sister has those symptoms and you start showing signs, you should quickly go to the hospital for a checkup. So I would say family history is one. Another one too is stress. Too much stress can, affect the whole correct cycle of the body. And then it causes increased cortisol levels and all that. Another factor for PCOS, like I said, is the genetic factor. Some genes can predispose you to PCOS. And earlier when I talked of the hypothalamic pituitary gonadal axis. So the pituitary gland produces prolactin. Yes, and then the hypothalamus pituitary gonadal axis coordinates the ovulation, menstruation, and all that. So normally people with PCOS will have high prolactin because it's like there's some discord dance going on with the ovary. Yes. So you notice stress, you notice failure of the gonadal axis, and then also family history can cause that, and then obesity. So it's funny, you would say PCOS causes obesity, and obesity can cause PCOS. It's more like a cycle because what happens is that the PCOS affects the hormones, and then with the androgen being in excess, it causes cravings for sugar and increased insulin resistance. Insulin is a hormone that regulates sugar in the blood. So when you don't have enough of the insulin, or your insulin is not working, or the pancreas in the body is not working to produce the insulin, you get diabetes. So you notice PCOS, some have issues with diabetes. So some of them would have. So with this diagram, you'd notice these are the symptoms. You notice the increase in fat in the abdominal area. And you'd also notice, like I said earlier, the luteinizing hormone goes up. And then also we have something we call ankathosis nigricans. That one is more like darkening of the neck
Okay.
and patches of skin tags.
Okay.
It shows that your sugar is not well controlled.
Okay.
Usually you notice those. And then we also have, like I said, insulin resistance puts you at the risk of diabetes, which is a cause of PCOS.
Okay.
And then also we have long-term and short-term complications of PCOS. Like I said, the cardiovascular problem, hypertension, diabetes, and then hyperlipidemia, high cholesterol can cause that. Like I said earlier, central obesity. So you just notice you are just gaining weight in your stomach area effortlessly with not much. All these are symptoms of PCOS.
Okay, so we've got a few questions coming in. So I'd like to read them and then we can continue. So this one says, thanks a lot, Doctor and Clock TV. Sensitization of these conditions are very important. I recently encountered a similar case. Kudos to you guys, Dr. Nick Bongo. Thank you very much for your submission. This one says, good morning, please. I am Sandra. I'm watching from Ashaiman, Lebanon. Please, I've been feeling movement around my vagina. Anytime I have an affair with my partner, blood comes. What should she do?
All right, so that's a different issue, but I would answer your question.
Okay.
We're talking of cervical cancer. I'm not saying you have cervical cancer, but we have the virus called the human papilloma virus, which HPV, which causes cervical cancer. And also we have something we call cervicitis. That's inflammation of the cervix, which comes as a result of the HPV, and continuous inflammation can lead to the cancer. So what I would advise is that you would have to screen for a pap smear. You would have to do a pap smear. So a pap smear is you're going to use a speculum, and then you're going to pick up a sample from the cervix to check if it's malignant or benign, if it's cancerous or not. So one of the symptoms of cervical cancer is postcoital bleeding. After sex, you bleed. And pain during sex, excessive pain during sex.
So another question here says, good morning. PCOS, can they give birth in this condition?
Yes, that's a very good question. One of the long-term complications of PCOS is infertility. But when diagnosed early, like I said, going for your checks early, and you are managed with medications, like you are put on, one of the treatments is put on contraceptives. That's the OCP, that's the oral combined contraceptives. Those ones help regulate your cycle and then helps with you having a regular menstrual flow. And then it kind of, when it's done for like some time, it resets the body. And then you're able to start ovulating when you are off it, and then you can get pregnant. So it can be managed very well. Some people are also put on metformin, which regulates the insulin sensitivity and resistance of the body, and that also increases your chance of ovulating.
Doc, I think you should shed some light on the combined oral contraceptives, because there's this stigma around it that it is all just to be able to be having indiscriminate sex, but there is more to these contraceptives than we are aware of. So if you can shed some light on that.
I would really wish to throw more light on it, because I have a sister who actually has severe menstrual cramps to the extent that she cannot go to school. She cannot do anything for 1 week. So usually in that case, when there's an exam, would you say she forfeits the exam? No. She needs to be on contraceptives. So then the doctor, her gynecologist, will put her on contraceptives for some time to avoid the period, so that she could just write the exam and then continue with her life. So contraceptives should not be stigmatized. It's very important. It helps with recycling and resetting the body when women have hormonal challenges. And one of the treatments of PCOS is using the contraceptives.
So what are these contraceptives made of?
So like I said, PCOS is having over-exertion of androgens. And these contraceptives are made of progesterones and estrogens. Those hormones is what make you a woman. So the introduction of these hormones in the body kind of balances out the hormones, and then you just function out well. Because when you have so much androgens, then you are going to exhibit symptoms of male pattern, like male characteristics, which you are, and you are female. So then you see the body antagonizing each other, and you are not feeling well all the time.
So thank you so much. And please, as you've heard about these contraceptives, please do well to ask your gynecologist before going to purchase any. Make sure to ask questions and get detailed information before you take anything, because these things always have side effects.
Okay,
it's best to know what you are getting into. Talk to a doctor, please. Yeah. So let's get the other questions, then we take a break. So this one says, hello, good morning, madam. Please, can leukocytes cause infertility in both men and women? If yes, what treatment can you recommend for us? I did a urine test and leukocytes came out positive. Please help out a sister. Each time I'm on my menstrual cycle, I always see clotted blood in my urine.
All right. So leukocytes is just white blood cells.
Okay. So
which shows that there's a sign of infection.
Okay.
So usually what worries a doctor is what we call PID, pelvic inflammatory disease.
Okay.
Which can cause infertility in a woman.
Okay.
When over time has not been treated. So then you need to treat with antibiotics. You need to be on some medications. You need to see your doctor to be treated very well with antibiotics. And we need to do a urine culture. Okay. To know what particular bacteria is causing the infection, and then we treat once and because sometimes we use broad spectrum antibiotics to treat this urinary tract infection, and at the end of the day they come back recurrent infections again. So like she said, it's very important because it will eventually affect your childbirth when it comes with clogged fallopian tubes and pouch fluid in the pouch of Douglas. That's a part of their respiratory their reproductive system. And all these things can affect the fertility. And likewise in men as well. When your partner also is, if you are treated and your partner is not treated, you go back to your partner, you'd get reinfected. Okay. And your partner is already infected, it affects the urethra in the penis. So that's when some of them would have, you would have double stream of urine, dividing urine, and then at the end of the day, they end up having to wear a catheter when they are growing old because the urine can't come out in the correct way. So treating infections is very important when picked up with a urine routine exam. Okay.
So this one too is, my question is, this PCOS mimics many conditions, especially in women. What is specific about PCOS that makes it different from others?
So that's a good question. Like I said, PCOS is syndromic. Like it's a combination of different symptoms, and it mimics other symptoms. Like I said, thyroid, hyperthyroidism, where there's loss of weight, sweating, over excessive palpitations, and all that. Hypothyroidism, there's weight gain. So people will say you are lazy. It's not like you're lazy. You're always tired. There's fatigue. So these are the differentials of PCOS, and other things like diabetes, obesity. Like you can't. So the question she's asking is, what will make you say this is PCOS? Yeah. So that's when we come with the criteria. When your period is less than 9 cycles in a year, whereby there's 35 days apart between the cycles, with oligomenorrhea, which is scanty blood, or flowing in excess when your period comes, with symptoms of string-like pearls in the ovary cortex, we can confirm that's PCOS.
Okay, thank you very much. It is time for us to go on a quick break. When we come back, the phone lines will be opened for you to call in and ask your questions. Keep your questions coming in onto our WhatsApp and our YouTube and Facebook live stream. We really appreciate them. Just stay tuned here. If you have a friend or colleague, anybody around you that you think this is very, very important for them to also know about, just tell them to tune in to Clock TV or find us on Facebook or YouTube and join in the conversation. We will be right back. You're welcome back to the KOKO Digest Morning Show. If you're just tuning in, this is the KOKO Digest Morning Show, and we are discussing PCOS, treatment, symptoms, everything about it. So you can send in your comments and your questions to our live stream on Facebook and YouTube, and also to our WhatsApp number displayed on your screens. The phone lines will be open for you to call in and ask your questions as well. So, Doc, we have one more question here. He says, good morning again. Do PCOS never ovulate, or is it menstruation? I think he's asking whether they never ovulate or menstruate, and if it is irregular, can IVF be a way to go?
Okay, so it looks like you are just having a salad of your questions. It's everywhere.
Yeah.
Okay, so PCOS, you don't ovulate.
Okay.
Because the eggs aren't coming out.
Okay.
The stages of egg, we have the follicular phase, and then we have the phase that the eggs will come out.
Yeah.
So it ends with the follicular phase.
It doesn't complete
yes,
the
it doesn't
cycle.
complete the cycle, yes. With IVF, it's a type of method if you're trying to get pregnant, which is different from the PCOS, but then it's a solution if you are not ovulating.
Okay.
To introduce the fertilized ovum inside the womb for you to have your child.
So
he just asked the question and giving the solution.
So is it possible to have a fully developed ovum that does not come out?
Yes, it's possible.
Okay.
Yes.
Okay. So let's go quickly into treatments, and let's start with diagnosis. So how do we diagnose PCOS?
So I think we've spoken a lot about it, the fact that irregular menstrual period, right from puberty, you notice your period. But you should note for mothers or aunties or guardians, when a woman, a girl starts her period, it's mostly irregular for, let's say, the next 6 months.
Okay.
And then it starts regularizing. When it regularizes and then it's normal, and now you notice that it's now changing back, whereby 3 months, 2 months, you've not had your period due to stress, and you know you're not having sex, and you know you're not pregnant. There's another probability why you're not having your period.
Okay.
It should be looked into.
Okay.
Yeah, so those are the things that cause that.
So as a lady, if I'm getting irregular periods and things, what do I go to the hospital? What am I even? How do I go to the hospital? Or what do I seek in the hospital?
Yeah, so we have a clinic for women, the gynae clinic or well woman clinic. You come and report to your doctor that you're having irregular menses, and then we do a hormonal assay.
Okay.
We check your LH, FSH,
Okay.
your estrogen, progesterone, even your androgen levels.
Okay.
All those things will give us an idea of how low or how high your hormones are.
Okay.
So based on that, with PCOS, your androgens levels go very high, and that's diagnostic with the fact that you are having irregular menstrual period. And then some would come in with weight gain and mood swings and feeling depressed and down for no reason.
Okay.
Exactly. Those are all symptoms of
Okay. So for the hormone test, is it a blood test or
It's a
urine
blood test.
Okay.
It's a
So
blood test,
what about,
which is done preferably in the morning. Because the hormones follow a circadian pattern in the body. Like it's more or less like at this time it peaks and it comes down.
Okay.
So you just don't wake up to go to the hospital to say you want to do a hormonal test. It should be you should be guided, and then at a particular correct time, the blood test is picked, and then we're able to know exactly what is happening to you.
Okay. So what about scans? How would scans help with a
so
situation
an
like this?
ultrasound is very important. If you do a scan, the scan is just the normal, using a probe and then a gel, like when you're pregnant. So the way you're able to pick up a baby, you look at the ovary, and then you see that string-like pearl structure, and you know that there's PCOS going on. If you are not convinced, you do a transvaginal scan. Where you have to go through the vagina with a probe, and then they are able to see directly with the ovary, because PCOS can happen to one ovary, and the other ovary can be normal. Sometimes it can be bilateral.
Okay.
So one ovary is fine, the other one
isn't.
Isn't. Yeah. So this is how you diagnose PCOS.
So with treatments, what are some of the treatments that are available for us or recommended?
So usually we have more or less conservative treatments for PCOS, whereby the doctors say exercise, less stress, eat well, less fatty foods, drink good water, sleep is very important when dealing with PCOS.
Okay.
Because, like I said earlier, cortisol level rises up. It increases insulin resistance. The insulin resistance can cause increased hyperandrogenism, which leads to the PCOS.
Okay.
So it's very important.
We have a caller on the line, so let's put a pin in that. Yes, hello, your name and where you're calling from, please. Hello.
Hello.
Good morning. Your name and where you're calling from, please.
Pacho mekasa free malam boy.
Okay. Pacho, ubeti mi bisa wa wasem bisa.
Pacho. Doesn't bisa I'll buy any Memphis. Me de la hospital na mo say daddy na obi no. Ade na otun ko hia fam no e ba akope. Doesn't bisa doctor say ebetia empusu betia be mo ana.
Okay. I think she's saying the daughter or something has only one ovary.
Oh, okay.
Yes. Is that possible? Or what to do?
So what's the question?
So, Pacho, hello?
Is she trying to say, is it normal to have one ovary?
Yeah, the daughter has just one ovary and she wants to know if the daughter would be able to have a child.
So that's big tree.
Yeah, you can. I think so.
Okay, so I mean, did you say Obana or Nkusia back our ovary back no? Obetumi awo because ovary no yemi no. Incident there happiness said this month way back way to Nkusia next month no way so betu Nkusia. Inti our back no chances no be lower say on to mean to Nkusia but definitely obetu Nkusia na only sperms na share na wenya akwala. So it's possible say obetumi anyaba but ebeye enye gidigidi sa but with omo monitor it's very possible.
Okay, so we have another one. Please, how does a PCOS patient lose weight? So yeah, we were talking about lifestyle, the treatment, so eating well and things like that.
Yeah, so eating well, avoiding foods with diet. So it starts with your oils.
Okay.
A lot of fatty foods or fried foods. Most of the food should be boiled or grilled.
Okay.
And then the oils you use should be minimal. And then mostly recommended sunflower oil, soya bean oil.
Okay.
And also I think we should go more of baked
food.
yeah,
Okay.
baked foods.
So
And then vegetables, very important.
Okay.
But make sure you wash them very well.
Yeah.
And then you kind of like add it to your meals. Yeah, to kind of it increases the fiber, and then it avoids bloating and helps with ease with digestion.
So with the you know the link to diabetes and sugar and the rest. What about carbohydrates? Because the little signs I remember, carbohydrates tend to glucose, all of that. So what about carbohydrates in our diet?
Yes. So with PCOS, you need to reduce your carbs.
Okay.
Yeah. So more of high protein, especially lean meats.
Okay.
You don't go for red meat, and you go for lean meats. More of white meat, which is very important, and then more of vegetables.
Okay.
So what usually we advise that before eating, you drink water to feel full, and then you start with the vegetables and then the meat before, or the protein or fish preferably, salmon or grilled fish. And then you go before you start. So the last thing you would eat is the carbohydrates.
Okay.
Then you would feel full, so you wouldn't have to finish everything. Yeah.
So don't go and consume one food, kinky. I'm talking to somebody. So what about exercise? Because even with exercise, there are times where exercise can become stressful.
Yeah.
How does somebody with PCOS manage maybe going to the gym, these workouts?
Yeah. So this gym workout thing, it's cool, but it's not realistic, especially when you have a job that you need to wake up very early, come and go to work and all that with traffic and all that. So make sure you are very active during the day. Take short breaks from your desk, walk around, visit your friends, have a chat. Use the staircase instead of the lift. Buy your food yourself. You don't need to send someone around. We do that a lot in the office. Just take a walk around and then feel like you are sweating. All these things help reduce the level of sugar and then the level of fat in the blood, and then it helps with weight loss.
Okay.
Yeah. But if you could also go for hiking or like maybe just with a group, you could decide to go for walks on weekends when you are free. Yeah.
So what about if you have a gym close to you? Are there recommended, or are there workouts that are not recommended for PCOS patients?
No, PCOS, you could have a range of workouts.
Okay.
Any this thing, but I think where you work on is the stomach, because one of the symptoms of PCOS, the picture we showed earlier, it's more or less like
the weight gain.
Yeah, weight gain in that area.
Okay.
So we need to work on the stomach exercises, and then we would have to do the sit-ups and
Okay.
Yeah.
So with PCOS and infertility, there seems to be some fear that people with PCOS cannot have kids. How true is that, and how can that be navigated?
Yeah, so it's true. PCOS, you might not be able to have kids when it's not managed well.
Okay.
Because it's a very simple issue in the sense that when you just do the right thing and you ovulate, that's your miracle. So we've been having this breast screening we do for women. So we go around and examine their breasts. So I picked up one patient. There was milk in her breast, so her prolactins were high. We did a test.
Okay.
It confirmed her prolactin. And we put her on medication. We put her on Dostinex. And then we did a scan. It all showed the string-like pearl. So we realized she had PCOS, which was not diagnosed. And she's been married for 8 years. Okay, and she's getting to her late 30s. So what we did was that we started the management. We tried to lower the prolactin level, so it stopped the milk from coming, and then it lowered the prolactin. We told her to start being active, exercise, lose some weight, and believe you me, in the next 2 months she was pregnant.
Oh, that's beautiful.
She was pregnant, and so it's something that is just. That's for infertility. You could miss the window period for so many years, which is just something very minute you'd have to do, and just that little thing changes everything.
Okay.
Yeah.
So, we may need a part 2. Please, I always feel pain and bloated around my abdomen each time I have sex with my husband. I even felt something moving around in my pelvis. What is the cause? I think someone had a similar issue. And
I think you should
just
do a scan to rule out uterine fibroid when you feel movements in your abdomen and the pain as well. Because fibroid comes with severe pain and feeling of movement and bloated, like feeling bloated. PCOS, you won't feel movements in your abdomen.
Okay.
Just you feel bloated and an increase of weight of fat in the abdominal area.
Okay. Someone also says she feels pain and vomits during her menstruation. Is she liable to be a victim of PCOS? Oh,
those are symptoms of menstruation. Sometimes, symptoms of menstruation mimic symptoms of pregnancy because it's all hormonal, the estrogens and progesterones.
Okay.
With pregnancy, the progesterones are more, and with menses, the estrogens are more.
Okay.
So, symptoms of vomiting, feeling, some even run, passing loose stools, running, mood swings, cramping are symptoms of menstruation, which is normal.
Okay.
Yeah, it's no cause for alarm. But with symptoms that would drive your parents to take you to the hospital, where you need to be on painkillers, you'll be admitted, that is where we have to start screening for issues like PCOS and fibroid and other issues concerning women.
Okay. So our time has unfortunately run out. I wanted to ask if there's a way to get the ovules that have not come out to vanish, dissolve or something.
So surprisingly, So it goes.
Okay,
it goes away. It goes,
okay.
Yes. So you notice you do a scan and then they'll say you have a physiological cyst and then you have string-like pearls. And then if managed, one of the signs a doctor knows that your PCOS is doing well is when you do the scan and then they notice that the structures have reduced.
Okay.
So it can be managed.
Okay,
yes.
that's really great. But I think we may need a part 2 of this because our time has unfortunately run out. Thank you so much for this education. Do you have any last remarks to give to our viewers before we plan the part 2?
I think I'm very excited about this topic because it's something that's underdiagnosed.
Okay.
Especially with our culture where we don't often go to hospital for checkup for women, young women, but lots of them have PCOS and they don't know.
Okay.
So I would recommend that mothers and guardians start allowing your kids to come for checkup.
Okay.
Come for checkup. The gynae clinic, the woman clinic would have the pap smear. If they are virgins, we'll do the vaccine for them, and then we screen their womb, we screen the ovary, we check for all those things, we do the hormone test. So I just recommend that be proactive about your health and in that of your children concerning, because PCOS is diagnosed right from puberty.
Okay.
So once they start coming to the clinic, doctor picks it up and it's managed very well.
Okay.
And the chances of fertility is high.
All right. Thank you so much. And this was a very, very inspiring and educative conversation. I'm sure you also learned a thing or two. A big thank you to everyone that made this show a success. Thank you for your comments and your shout outs or everything that you sent to us here. Thank you so much. A big thank you to our management and our production team. A big, big thank you to our sponsors as well. Thank you so much for joining hands to make this show a success. Now, today the KOKO Digest Morning Show ends here. We will be back with a part 2 very soon. It will be communicated when it is ready, and we will talk more about this. We would even add the fibroid issues because I know a lot of women are very much interested in this. So, my producer says I should read some messages again. Okay. I'm wrapping up. Beautiful. Okay. So one says I had a blighted ovary. Okay. One says I had a blighted ovary and I was asked by my doctor to do a D&C. After all this, my period is not normal. It is small and dark. We will text you back and then give you. Hey. So we had my producers. Can PCOS affect a woman's chances of getting pregnant? Yes, if not managed properly. So then if you have PCOS, what are the medical problems you are at risk for? What parts of the body are affected by PCOS? That was in the earlier submissions. Is PCOS inherited in families? Yes. Does it run in families? Yes, it is. Good morning, Doc. My sister is not overweight. Can she still have PCOS? My doc says yes, she can. It's a hormonal issue. So high level of androgens is the main issue. Hey. How? Okay, so Yaira, I like your question. What is the best treatment for irregular periods? Does irregular periods affect a lady's chances of getting pregnant? I have other skin problems like boils on some parts of my body. Are these related to PCOS, and what is the best treatment for them? Unfortunately, our time has run out. We will come back with a part 2, so please hold on to your questions. Even though I was asked to read them, we will have a part 2 of this discussion very soon so that we can answer all your questions. But for today, this is all we have for you. And as I've already signed out before my producers made me read, so do have a blessed weekend ahead.
Clog TV. Beyond the policy.